going to see the mental status examination as part of the neurological examination. So most of the time, this is the first part of the neurological examination that we do or that we perform. Remember, we have general neurological examination, the first one. Then, if we are going to do a detailed one, we will do the mental status examination. Then, maybe motor skills, sensory skills, reflexes, and gait and coordination. Alright, so let's begin with the mental status examination. For this, one way to do it is using the mini mental status examination, that is the one that I'm having here. Now, in the mental status examination, we are going to test these 4 spheres. Orientation, or let's say consciousness or alertness, then language, memory, and visual skills. So that is, we cannot do anything if the patient is unconscious. So first we need that the patient be conscious. Then we will test the language, and we could also test memory, but how will we know if the patient has memory if we don't know if the patient can communicate with us? And at the end, the visual skills. Because in a sense, visual skills depend on memory, as we will see. So, on consciousness, we have different types of alertness. So one is, alert, you see the patient and you see that is completely alert. The other is, the patient could be comatose. Comatose is the, let's say, on the other extreme of alertness. Here the patient is completely unconscious. Maybe if we give some nauseous stimulus or some painful stimulus, the patient can pull the hand away or can rotate the limbs inward or something like that, but this isn't anything that is meaningful. Next we have stupor. Stupor is when the patient when we give the painful stimulus, the patient opens the eye. So opens the eyes when we do a painful stimulus or when we give painful stimulus. And then we have drowsiness. Drowsiness is when the patient opens the eye when we give the command, when we say open the eyes. So the patient will open. So with the commands. So we have alert, drowsiness, stupor, and coma. So the patient could be in anywhere of these parts. In a sense, this is just a way to communicate when we give the alertness state of the patient. So, alright, now that we see that the patient is alert, we would proceed with language, memory, and then visual skills. So, I'm going to kind of do the mini mental status examination, seeing the questions and giving the explanation or the question behind each question, and sometimes I will skip a little bit, and at the end we will see a little bit more of integration, what I mean with testing these 4 spheres. So, the first is, as I begin with the question, the first question is, what is the date today? But before this, we can test, for example, if we talk a little bit with the patient, let's say, tell us about the history of the patient, if the patient is from this state, what happened before coming to this state, or something like that. So before the mini mental examination, we can have a talk with the patient, and this will aid us in, we will see that the patient is alert, obviously is talking, the language is fluent, is communicating with us, and has the memory because we'll be thinking about, or will be telling us what happened before coming to this state or something like that. So beginning with a conversation is very useful for the doctors to assess all these fears in a sense. Well, then we will proceed. Now, we could not only have the conversation with the patient, because we could miss some very specific things. So for that we will do the mini mental. So we begin. What is the date today? The patient says whatever, for September 2021. it doesn't matter in the way the patient says, the month, year, whatever, and you just record it. So the patient has a credit for that. Then, what is the season? This could be a little bit confused, like 1 week before changing of season. So the patient can say, for example, if it is February, certainly we expect the patient to say that is winter. But if it is, for example, winter begins the 22nd of December. But if we are, let's say, in 12th December, and the patient says winter, we can take it as, okay, because it's very confused if in that date it is winter, it is fall, whatever. So we could be a little bit flexible in like 1 week of margin in the change of seasons. And then, what day of the week is it? It is Sunday, Monday, Thursday, etc. What town, country, and state are we in? So the patient should say whatever town we are being handled at. What is the name of this place that is in which, if we are in a hospital, we are expecting the patient to stay in a hospital or something like that. And then what floor of the building are we on, if it is applicable. Then, so at this moment we are testing certainly alertness because the patient is answering us. We are testing language in the sense that the patient is communicating with us a little bit. And now let's see memory. I'm going to name 3 objects, and I have said them. After this, you repeat them. Remember what I'm saying because you will repeat them. So you will give just three items. Could be whatever. Let's say apple, table, penny. Just that. You can repeat them only if the patient asks you to repeat them, and then you will continue. Alright, so you will ask the patient now to repeat it immediately. So you say, and then the patient says again. Alright, so the patient says it. Alright, so let's continue with the other one. I'm going to spell a word forward, and I want you to spell it backward. The word is world. So we are just saying the patient this word. So this is the patient this is the word that the patient is listening. We said spell backward the word world, and so the patient needs to you said the word world, and you spell it then WORLD, and then the patient needs to say it backward. We'll say DLROW. Certainly not as fast as I'm saying it because I'm saying the whiteboard, even though for me it's very difficult to say it. So certainly we will not write it. We will just say I'm going to give you a word and you will spell it backward. So the word is world, WORLD, and then the patient will say it. So here we're testing 2 things. One, the parietal, let's say, function, because the patient is like seeing the word. It is not writing in any place, but the patient is like thinking on the word, is having here, and is like I don't know if you can think in this, like the patient have it like this and then spell it. So it's spelling it, is communicating, is giving the language, but also has some visual space with the word having it like here present. I don't know how to say it. Actually, any memory is like that. We remember it. It is like if we were seeing it, but we are actually not seeing it. So this is with the parietal lobe. Alright. Then, yes. Alright, so the word. Now, what are the 3 objects I asked you to remember a few moments ago? So the patient should say apple, table, and penny, in whatever order it be. So here we're testing memory again. We continue. What is, you will ask the patient, what is this called? And usually the doctor has a wristwatch, and so you just ask the patient, what's this called? And the patient should say, it is a wristwatch, watch, or something to measure the time, something like that. And then you could also say, what's this? Classically it is a pencil, and so the patient should say a pencil. Alright, and you put that. Then please repeat the following. Oh, this is very important phrase. No ifs, ands, or buts. So please repeat the following phrase. No ifs, ands, or buts. Be careful to emphasize the S at the end. This is a very important neurological phrase because it's a little bit difficult to spell it, certainly more because of the S. And here we're testing, as we will see later, we're testing fluency, that we already know that the patient is talking fluently, and more if we begin with the let's say speak with the patient with this history that the patient is telling us. So we are testing fluency, comprehension, because the patient is comprehending this because it has meaning, and the repetition, that the patient can repeat it, because in some aphasias that we will see, the patient can talk fluently, but if I said repeat what I just said, the patient cannot repeat it. Or sometimes the patient can talk fluently but without meaning, many things seen on the aphasia that we have in other videos. So we would just ask the patient, remember, we don't write anything, just repeat the phrase no ifs and or buts. So the patient needs to say that. Then please read the following and do what it says. You will give a written command. So a written command that the patient needs to execute the command. So here I have it. Oops. Here you will show this to the patient. Please close your eyes, and you will see that the patient closes the eye. So here we are testing the writing language. That is, we are testing that the patient, certainly if the patient has no language or any language problem, the patient would not be able to do that. So we are testing that. Then please write a sentence. Here we will give the patient the paper and the pencil to write a sentence. We will not approach the paper to the right hand. We will just let the patient take it. So I don't need to write just a sentence. And here we're testing language, that be something meaningful, and we're testing the handwriting. And then please read a sentence. Then take this piece of paper in your right hand, fold it in half with both hands, and put it on your lap. So, alright. So we give, let's say, a paper to the patient, and we say to the patient, take this paper with your right hand, double it in half, and then put it on your lap. So here is very important that we don't approach the paper to the right hand of the patient, because like that we are giving a clue, and we want to know that the patient is completely right. So then the patient will take it with the right hand, and then with both hands we'll fold it and we'll put it on the lap. So here we're testing language, and we're testing the comprehension, the following of the command, the execution of the command. And lastly, please copy this drawing. So usually it's some kind of this drawing in which there are two pentagons that are intersecting. So we should see that the patient draws the pentagon, so 5 sides in each one of the pentagons, and in the intersection we need to see 4 sides. So the intersection figure has 4 sides. And sometimes the patient could ask with the overlap or without overlapping, and we could not give any clue. We would just say drawing as you are seeing it. That's it. So as you can see, we test certainly alertness, language, memory, and visual skills. The visual skills certainly was this, the drawing, but also when we test, for example, spell backward the word because the patient is having it here on the head. Now, the mini-mental is usually is to 26, something like that point. It could be adjusted or 30, something like that. But actually it is not very meaningful if the patient don't have less than 20 points. Now, it's very important to do the mini-mental status exam, the mini-mental, because sometimes we can lose things. For example, maybe the no ifs and or buts, we can lose it if we don't talk with the patient as in this fluent manner. So just giving a history, maybe we will not see, because in a history, for example, the patient is just talking to us, but we are not testing, for example, repetition. So for that is the mini-mental is a very good way to do it. Now, sometimes we cannot do the mini-mental this mini-mental test because the patient is intubated or because the patient cannot move or something. So there are other ways in which we can test the same thing, because the goal of the mini-mental is to test the consciousness, language, memory, and visual skills. So these are the 4 spheres that we are testing with the mini-mental test. So how could we test consciousness? Let's say the patient cannot talk. So how could we test that the patient is alert? We will do things that require attention. So if the patient can do what we are saying that requires attention, that means that the patient is alert. So here, things that require attention. Let's say you can play a game with the patient. You say, if I clap once, you clap twice. If I clap twice, you don't clap. And so you do this. I will do the sound here of the doctor and here the sound of the patient. So something like that. So you see that certainly if the patient does this, well, it's because the patient is paying attention, is completely alert. Yes, sometimes the patient can get it wrong. Sometimes the patient would give, in this case, would clap when the doctor gives twice. So was an error of commission. But this error of commission is because the patient is persistent, is paying attention, is persistent. Or the other would be the error of omission, in which we clap once and the patient didn't clap anyway. But you know how much margin you are going to give the patient. So you need to test it. This you need to do it a lot of times, or sufficiently enough that you see how it is. So you can do this. Now, how could you test language if the patient cannot talk or if the patient is intubated? You can test language. If the patient cannot talk, you can say, for example, raise the hand. If you mean yes, raise the right hand. If you mean no, raise the left hand. And so you ask many questions, like many questions that you know the answer. For example, you ask, I don't know, is if let me think someone. Well, I think that some doctors uses the president as a good guide, and so they ask, is A the president at this time? And the president says like this, that means yes. Or is B the president? No. Is C the president? No. It's like that. So the patient would be raising the hand, meaning yes, or raising the hand many times meaning no, or something like that. The other way is, instead of doing with the hands, if the patient cannot move, you would do it with the eyes. And you could say 1 blink is yes, 2 blinks are no, something like that. So the patient will communicate with computer language, Boolean language, yes, no, with 1 blink and 2 blinks. So 1 blink is yes, 2 blinks are no. And or other way is looking upward is yes, looking downward is no. So you can test language. It will be more difficult, yes, but you can always test language. And memory is more useful to test memory if the patient gives us a history instead of we just give, or we just tell a history to the patient and just say, remember this part of the history, and then we go come back and ask that later. Is very unlikely that the patient remembers that because it's not something that the patient is interested on. So we would let the patient to tell us a history, and certainly we're testing the memory of the patient. So that's a good way to begin, for example, the mini mental examination, talking with the patient, something that here just begin directly with the first item. And lastly, the visual skills. If the patient cannot draw, look, watch this. We will ask the patient, for example, that maps could be the map of the United States, could be the map of South America, could be the map of the world, and we would ask how, if you are on Mexico, how would you, or which way would you go to United States? And the patient would say north, or something like that. You can put it directly with the states to do it better. You give the map of the United States, and you say you are in Florida, how you go to Washington, or something like that, and the patient needs to say the direction that I myself don't know that, northwest, southwest, whatever it be, but the patient needs to say that. And so you know that the patient has the visual skills because he's visualizing it, certainly needs memory for this, and can communicate. And lastly, there is something that, yes, we will test other things in other parts of the neurological examination, like motor skills, etc. But that is more like a strong, or if there is problem with the nerves or something like that. But we will test here. Here's something called the praxias. Praxias is something that we learn to do. It's a motor skill that we learn to do. For example, play the piano, riding a bicycle, something like that. Sometimes patients cannot do this. Sometimes because the extremity is weak, they cannot move the extremity or something like that. But sometimes because they lose the apraxia command, that is, the extremity is not weak, they can move completely the extremities, but a Broadband area 6, that is the area of the praxias zone, that is the planning and the sequence of movements need to do the command that we already learned how to do it, that's damaged, and so the patient cannot execute this sequence of things. This is called apraxia. So could be apraxia of playing the piano, apraxia of riding a bicycle, or something like that. Now, sometimes they call apraxia of gait when the patient now cannot walk, but this is misleading because every baby learns to walk. There is no need that the baby be seeing or needs to be seeing other people walk. No, at the end the baby will walk. So there is nothing like that. The walk was learned in a sense that, for example, piano, certainly we need someone to teach us, but for example we don't need someone to teach the baby, for example, how to drink the milk of the mother. Here we help, but there is no need to teach the baby to walk. So we will not use the term apraxia of gait. We will use just gait and abnormalities, and for other things that do are apraxias, we will use the term the patient has apraxia. Alright, now, and lastly, the apraxias could be ideomotor apraxias, or idealization apraxias. So in one, the idea is wrong, and in the other, the way to do it is wrong. So look, we could ask the patient that the praxia be, how would you hang something on the wall? So you do something like this. This is the correct way. A patient with a idealization idealization apraxia cannot do this because the patient has the wrong idea. The patient will do something that is completely like without meaning. That you will say like, what the patient is doing. That is, you ask the patient, how would you hang a square? And the patient begins to think, for example, or the patient just do whatever, something like that. A thing that's completely different. And this is because the patient has the wrong idea of how to do it. But if you say, no, you need to do this, the patient will do that because now you are giving the idea, and so now the patient can do that. But in a patient with ideomotor apraxia, you will say the patient, how would you hang something on the wall? The patient has the right idea, would do something similar, but would look very awkward, awful. The patient will do something like this. This is, it is changing, for example, the hand. Instead of putting the pin something like this and doing this, it is confused between the hand and the object, because look how an object could be the hammer and is using lead, and the object, instead of being this penny, or I don't know what it's called, is the hand, the one that is being hit by the other hand that is another object. So this is object hand confusing. But the patient has the right idea, but you see that it is like awful how it is doing it. And if you say, no, it is like this, the patient would continue doing it this way, or will do something a little bit different, but would not do the thing as you are saying the patient. So the ideomotor apraxia, the patient would not correct, and looks similar to what you are looking, because the patient has the idea, but it looks awful. And the patient with idealization apraxia would not do what you are saying the first time, because the idea is wrong. But when you correct the patient and you show how to do it, the patient will do it. So this was the mental status examination. We saw the mini mental as a guide to do it, but remember that you always can do it. You just need to test the four spheres: first consciousness, language, memory, and visual skills.